fit in that mix. What should hospital marketers, CEOs, executives know about the exchange, and how should they communicate those messages to their consumers?
Good question. But, the exchange, regardless of what people may think about the Affordable Care Act, it is the law of the land, and the exchanges are going to be the sort of interface for many people in Wisconsin between themselves and connecting with health insurance. So for example, there are about 90,000 people coming off of our state's Medicaid program on January 1st. And those are folks that are making somewhere between $15,000 and $18,000 a year. So really not very well off. And so they're going to be going into the exchange, now that they're coming off of Medicaid, to find coverage and hopefully connect with coverage and maintain coverage through the exchange. This is a population that typically does not have a lot of experience with commercial insurance or employer-sponsored insurance, so they're going to need a lot of help, a lot of education, and a lot of assistance when it comes to accessing coverage through the exchange. And that is really a key role that we think our members and healthcare providers across the state can help serve, can help play, is helping educate folks, particularly those coming off of Medicaid, but others, about how you access the exchange, the types of information that's going to be needed when you do access the exchange, because there's a lot of information that's required to be entered to enroll and determine what type of a subsidy you're involved with and all that sort of thing. And we just naturally tend to be more knowledgeable about healthcare issues than the general public, especially not just care delivery, but insurance and finance related issues. So hospitals definitely are positioned and equipped, I think, to play an important role in helping people connect with the exchange. But it really is incumbent upon us to do that, because the last thing we want are people showing up in our ERs without insurance, because when someone comes to the ER, we take care of them. Best to take care of those people when they have insurance, and when you have insurance, you're typically more likely to get care in a more appropriate setting. So we have a lot of reasons as hospitals and health systems to really engage this population and help them learn about the exchange, and to the extent we're allowed, help them actually access coverage in the exchange. And I view it from a PR perspective, I view it just as important as, and no different from, any other sort of marketing sort of efforts that you're engaged in. Being creative, knowing your audience, and knowing how to get to that audience in an understandable way, I think is be critical if coverage expansion, particularly through the exchanges, are going to be successful in Wisconsin.
Okay, now with that said, what resources are available from the Wisconsin Hospital Association that people can reference to?
Yeah, we've been doing a tremendous amount to assist our members so that they can assist people coming into the exchange. So on our website, there's a great deal. There's a whole separate section about the exchange's enrollment on our website that just constantly is updated and includes some of the most recent